Thanks so much, Julianne, for that introduction and for your welcome to your evening, your support and share night. I'm just getting to know Julianne, and as I think many of you are as well, and really enjoying that. And I want to say right at the beginning that two of the volunteers at Compassionate Ottawa, Marion Rattray and Anne DeButt, are very active with BFO as well. So I know quite a bit about your group from them and from my own knowledge of the community and my own reading. So there's a specialness for me in being here. Excuse me. And as Julianne said, I'm going to talk a little bit about Compassionate Ottawa and what we do. And then I think there will be questions and discussion as Julianne has suggested. So I'm going to start with telling you a story. In fact, I'm going to tell you 2 or 3 stories as we go through the first part of the evening. And I'm going to start by telling you about a friend of mine and who I will call Cindy. And Cindy helps me occasionally, particularly in my garden, which, gets kind of unruly quite often. And so Cindy comes and helps me a fair bit. And she does a few other tasks around my home. She knows that I live on my own, having been widowed several years ago. And she also knows that I have a daughter who has a serious illness, who from time to time requires me to kind of step up as a caregiver. Not very often, but from time to time, I need to devote my full attention to that. Cindy's a very hard worker. And it's very important for her to earn a little bit of money because she actually has a very, very modest income. She really has no money at all. She lives alone and she lives in what I call precarious housing. So a life that is not particularly comfortable in many ways. So early one morning last fall, I got a phone call quite early in the morning. I was actually still snoozing in bed. Cindy had woken up and she could not move her right side and she was in a panic. So she phoned me, got her calmed down, 911, off to the hospital she went. Hospital, a very strange and lonely place for her, especially because it was in the middle of the pandemic. And she found herself being admitted and was, within a couple of days, was diagnosed with a very serious cancer. Since then, Cindy's had lots and lots of treatment. And she's had her ups and downs. She's had moments of anger. She's had moments of hope. But there is one thread that runs through almost every day in Cindy's life. And that is that she's lonely. She's lonely. She's alone. She has no one. So not very long ago, I was able to, when she was over one afternoon, and we sat outside in my on my patio, and we began to have a conversation. And I engaged her in a conversation about her loneliness, actually. And we talked about resources that she could tap into. And we talked about what might happen over the next few months, including that she didn't know how long she had to live. I know I'm dying, she said. I know I'm dying, but I want to live as well as I can. At one point, she burst into tears. And through her tears, she said to me that never before in her life had anyone taken the time to sit with her, to listen to her, to ask her questions, to offer suggestions. Now, I was kind of surprised by that, but then I thought about what I am learning and hearing as a volunteer with Compassionate Ottawa. And I realized that while the details of Cindy's story, and everything I have told you is true, this is not a made up story. The details of Cindy's story, while they are true, her predicament in itself is not so unusual. I have learned through my work at Compassionate Ottawa that too many people are unsure about what is happening with them when they begin to have care. They don't know what their care will look like. They want to live they don't know how they want to live as well as they can for the rest of the time that they have. They don't know who will support them. All the things that Julianne said that we are concerned about at Compassionate Ottawa, they were all exemplified in the story of Cindy and so many other stories that I've heard. So many people in our community are lonely and are isolated throughout life, and they live with anxiety and worry and fear about the end of their life, about death. Maybe truer for people like Cindy, who lives on the margins of our community, but I'm not so sure that it is, because I think it's truer than most people realize. We're not sure about how to talk about our values and our wishes, our hopes and our fears. Many of us are really unsure how to talk about our own death or the death of somebody in one of our loved ones or somebody that we're close to. In fact, while it was true for Cindy, it was true for the woman, another woman I know, one who eventually kind of understood, and fortunately not too late, that her elderly mother, who kept saying to her, "Please make sure I don't die in one of those places." I think she was referring to long-term care. She never actually used those words, but she begged her daughter, "Please make sure I don't die in one of those places." And her daughter rightly figured out that what her mother really wanted to talk about was how she wanted to spend the rest of her life, how she wanted to live the rest of her life, and how she wanted to die at the end of that life. It was true for a young man that I know whose wife died a few weeks, probably more like a couple of months after a stroke. She was quite a young woman. They'd had some conversation, but he said to me, "We never had time to have the conversation about what was important to us as a couple." I don't know. I never learned what was going to be important to her. And frankly, it was true for me. I was baffled by the silence of so many people around me, especially in my workplace, after my husband's death. And I realized, I remember those moments so clearly. Why is no one talking to me? Why, in fact, are they walking the other way, avoiding me, moving away from me? That happens so often. Perhaps that's been the experience that some of you have had. Talking with each other is really hard. It is really hard. Conversations about how we want to live well, how we want to die well, and to grieve well are at the heart of the work of Compassionate Ottawa. We have as a vision a more compassionate community where everyone is supported and cared for. Through our conversations and our workshops, we hope that we offer people ways that they can look ahead and plan for how they want to spend the rest of their lives and how to talk with their family members or whomever is important in their life about those very things. We want to talk with people so that we can ease the discomfort around death, which is so isolating and so alienating for many people. We hope that we are in some small way helping people to live well, as long as they can, in the circumstances in which they find themselves, to die well, and to grieve well. Now, we know, of course, that the healthcare provider community is central to the care of everyone. But we also know, because we've had conversations with many in the healthcare system, we at Compassionate Ottawa, that they cannot do all of this care on their own. They know that, and they don't necessarily feel equipped. They don't want to do all that work on their own. Primary care providers, palliative care teams, community social service agencies, yes, important, we need them. But they are not the only answer to helping people live well, die well, and grieve well. And neither is the community on its own. But I believe that together, healthcare, social services, and the community can move us in the direction of providing the best care possible before the end of life, through the dying process, and after death for those of us who grieve. In the words of Dr. Alan Kelleher, who was the founder of the Compassionate Communities movement, let me tell you what he said. A compassionate community is one where its residents recognize that care for one another at times of crisis and loss is not a task solely for health and social services. It is everyone's responsibility. It is everyone's responsibility. This is called the social model of care. It is a model that draws on all the resources in the community, all the resources the community may not know it has, may think it doesn't have, hasn't discovered yet. All the resources that they have to offer in caring for each other. We have to activate those resources. We have to discover them. I know that they are there. I know that as an old community development junkie, that every community has the resources it needs to do what it wants to do, to care for each other, to care for everyone in their community. And that's what Compassionate Ottawa really is all about. It's trying to release, to capture, to release this passion for caring for each other, not on our own, but with all the other systems that exist in our community. So how actually do we do that, you must be wondering? How do we build on a community's resources? How do we build a more compassionate community? At the center of our work is that we facilitate group conversations around dying, death, and grief. We offer workshops and we offer learning events. For example, we didn't know what the heck we were going to do when the pandemic hit because all of our workshops and conversations were in face-to-face settings. So we invented something called Conversations with Leaders, which we had every 6 or 8 weeks. And we invited Dr. Alan Kelleher, who I've actually mentioned, to kick off our conversation. And we invited individuals, we had 6 of them, individuals who could talk with us in a conversation about building a compassionate community. We had no idea the response we were going to get. The last one we had, we invited 2 Indigenous elders. Little did we know how timely that their conversation with us would be, because it occurred about 2 weeks after the discovery of the first set of the graves of Indigenous children. So we invited them to talk with us about traditions, Indigenous traditions around death and grief. At this point, I think probably 800 people have listened to that conversation with 2 of these 2 elders. So that's really at the core of our work. It's inviting people into conversation. It's bringing them information. It's broadening and widening their understanding. We've hosted book chats. There's a wonderful book that many of you may know about. It's called Talking About Death Won't Kill You. And so we have had some facilitated book chats about that. And we're kind of looking at those now, we're evaluating them, and we're going to roll them out again in the future. We have created 8 digital stories, which are about to be released publicly. And they are stories that individuals tell about their role as a caregiver, the impact of the death of a loved one on their family life, on them, and how they are living with the grief that is part of their everyday story. So those are brilliant, brilliant digital stories that will be public fairly soon. We've hosted documentaries. There's one called Blue Roses. I don't know if any of you know about it, but Blue Roses is the story of people who live on the margins and are facing death and toward the end of their life. And there are 1 or 2 people in particular who speak in that documentary. And I think we've hosted that with Ottawa Public Health on several occasions. And we've had some other public learning events. We have something called Advanced Care Planning Workshops. ACP is how we refer to that. And those are workshops where we encourage people to think ahead, Think about your values, your wishes. What matters to you? How would you like to be cared as you get older, or you may be facing serious illness or toward the end of your life? We offer workshops around grief, helping people to understand grief and live with grief. And we offer these conversations and workshops in faith communities, in community centers, in schools, in workplaces, you name it, in the community where we're invited to do that. We're happy to have a conversation. So conversations and workshops are really critical, but we also sponsor some research. I just want to tell you very quickly about one really interesting piece of research that we are engaged with at the moment. It's called Healthy End of Life Project, or HELP for short. We refer to it as HELP, and we are working in 2 community health centers and 2 faith groups, where we are working to build and create networks of care. One of the things that we have discovered, I know it from my own experience, you perhaps know it from yours, it is really hard to ask for help. It is really hard to ask for help, and it's hard to offer help. So we're trying to figure out, how do we create possibilities and opportunities for people to ask for help and to offer help, because we believe that we all have the capacity to be helpful, to care for each other. So that's we're about halfway through that research, and then we'll build it through the community once we're finished with it. And we have some plans to do some more research around exploring attitudes toward death in various diverse communities, so that we can have more effective conversations with the many groups and communities within the city of Ottawa, as you know, very, very diverse, including Indigenous and those groups that are often not included in the mainstream of our life. And finally, we're planning a citywide event. We hope that this is going to be in May of 2022. There'll be some lead up events to it. And why are we doing that? We're doing that because we want to mark the end of COVID. We want to publicly mourn the deaths of what I think will be about 600 people. And there are other losses that we have all experienced as well. We want to thank those who have cared for us, everybody from the grocery worker to the transit, to the public, to the health workers. And we want to celebrate the rejuvenation of our community, highlighting how we have cared for each other and how we intend to care for each other going forward. So as we do that work, conversations, research, events like the one I've planned, we never do it on our own. We always engage and invite and accept invitations from others to work in partnership, because we have to actually believe very much that we want to model what it means to work, all of us together, to build a compassionate community. Now, we're a very young organization. Our founders had their first conversations at the very end of 2017, and we got active in 2018. That's when I became involved with it. And we are volunteers. We're about 80 volunteers. We have 2 fabulous staff who support us and make it possible for us as volunteers to do all the work that I've described to you. And we think we have a pretty good track record, but we're just beginning. We've had about 3,600 people come to our workshops and conversations. I've already told you about 8 digital stories. We have a very large mailing list, and we have lots of website visits. And we work in both English and French, but we're young. And we have a future that we think is filled with possibility and filled with, the unknown. We're not quite sure where it's going to take us. We want to expand our programs as we go forward. We want to reach people who don't normally, or are not always feeling welcome, I guess is how I would say it, who don't always feel welcome to be part of organizations like Compassionate Ottawa. We started out, that's not true. We didn't start out. We sometime in 2018, early 2019, we decided we need to have a tagline. And somebody helped us with it. And we put down the tagline was change the culture of dying. I will tell you right now, I was never a fan of the tagline, change the culture of dying. And people have said to us very quickly, what do you mean change the culture of dying? If I'm an Indigenous person, who are you to change my culture of dying? Or if I come from a different faith community or different culture, I value the way we, in my culture, regard dying and death and grief. So please don't tell us that you're about to change the culture. Well, boy, that was a wake-up call for us. And I am very grateful for the messages that came to us. Not many, but enough for us to say, we better ditch that tagline, because we are not about changing anybody's culture. We are about welcoming cultures. We're about saying, help us to understand what would be useful and what would be helpful for you. So we have an emphasis going forward in the work that I've already described to you to reach people who are part of communities that don't always feel welcome. We want to learn from them, and we want to be able to engage them in conversations. We want to spread the word around loneliness, because I tell you, I have not yet done a workshop or had a conversation, and the conversations are groups. They're not with individuals, where the topic of loneliness has not come up. And so we want to do we want to make sure that the community is really more aware of the loneliness that exists in up and down our streets, in our neighborhoods. We also want to do some work around caregiving and the caregiver stress, because we've learned quite a bit about that, and we're aware of the stresses that could somehow be relieved by understanding more about them and helping each other to address them. So I'm just about ready to end, but I want to tell you about Cindy, where I started a few moments ago. Cindy is in fact coming tomorrow. It may rain, but I'm not sure. She is coming, and we're going to start our morning together with another conversation. But I know what Cindy has been experiencing since we spoke probably 6 weeks ago, when we could first sit outside together. I know she has figured out how she can get some support from some community services. She actually told me on the phone the other day that no, she couldn't come because she was looking after the children of one of her neighbors who had an emergency that she had to go to. Isn't that what neighbors do? Isn't that what neighbors do? So she had figured out how she could offer that help. She knows that it is okay to ask for help. So I want to say in closing, and turning it back to you, Julianne, that in a way, Cindy is really why we are building a more compassionate Ottawa for everyone. We all are called to do that. We are all invited to do that for the Cindys of the world and for everybody else who lives on our streets and in our workplaces and our schools. So that's what we're all about, and I'm going to stop at that point. Turn it back to you, Julianne.